I'll give you a brief description about the anatomy of heart. As we already discussed that heart is the major system, major organ in the circulatory system. It's a hollow muscular organ, and it is around, the size is, it's around 300 grams. The weight is around 300 gram, and that is almost the size of a fist. Heart contains 4 chambers, that is 2 atria on upper side and 2 ventricle on lower side. Now the position of the heart is, it is found in the chest between the legs, and heart is surrounded by a membrane called pericardium. Pericardium is the outer covering of the covering of the heart. Now there is a space in the pericardium called pericardial space. We will be discussing in detail once we discuss about the pericardium. There is a space in the pericardium called pericardial space. It's a fluid filled space, and inside this pericardial space there is a fluid called pericardial fluid, which nourishes and it protect the heart also. We already discussed, it is the pumping, or it is the motor or pump of the cardiovascular system. Heart is the pump of the cardiovascular system. Now from the heart it is pumped into the blood is pumped into the blood vessels through the arteries, then the blood returns to the heart through the veins. Now heart is made up of cardiac muscle. We already discussed once we discussed about regarding the muscles, regarding the cardiac muscle. Now heart is made up of the type of muscle called cardiac muscle. Now the heart beat about 1 lakh times per day, and it pumps around 8,000 liters of blood per day. Now once you see the position of the heart, it's having a apex and base. The base or top. Here the top is considered as base, is around half inch from the left from the midline, and the apex or bottom, it is 3 inch away or left of the midline. Now the right side of the heart is slightly rotated so that the right side of the heart faces anteriorly. So the heart is having an apex, a base. Apex is around half an inch away from the midline, and bottom or apex is around 3 inch from left to the midline, and it is rotated slightly so that right side of the heart faces anteriorly. Now the position of the heart, we already discussed, it is in between two legs, and this area is called mediastinum. So there are 2 pleural cavities where the lung is situated. Lung is situated inside the pleural cavities. So there are 2 pleural cavities, and in between the pleural cavities there is an area called mediastinum, and heart is situated in the mediastinum. Now once we see the circulation, there are 2 types of circuits are seen attached to the heart. The first one is a pulmonary circuit, and the second one a systemic circuit. Pulmonary circuit is the circuit which carries blood to and from the gas exchange, that is which is attached to the lungs. That is, it carries blood to and from the lungs for the gas exchange. That is gas exchange surface of the lung. Systemic circuit, the other circuit is the systemic circuit. Systemic circuit carries blood to and from the body. That is, it pumps the blood towards to the body through the arteries, and it circulates throughout the body and return the blood through the veins. This circuit is called systemic circuit, and pulmonary circuit is one where the deoxygenated blood goes to the lung, it becomes oxygenated, comes back to the heart. This is called pulmonary circuit. Now there is blood alternates between these pulmonary and systemic circuits. Now the right atria receives blood from superior and inferior vena cava. That is, these are the part of systemic circuit. That is, right atria right side receives the blood from superior and inferior vena cava. Superior vena cava is the vein which vessel which takes the blood from upper side of the body, that is from head and neck. From the blood from the head and neck is taken by superior vena cava and given to the right atrium. Then there is inferior vena cava is also there. It also receives blood. It receives blood from the lower side of the body, that is below the diaphragm. This inferior vena cava takes the blood from the lower part, that is below the diaphragm, and it supplies, or the right atria receives this both superior and inferior vena cava. Now, blood from the right atrium goes into the right ventricle through a valve or through a orifice called atrioventricular orifice. This orifice is guarded by right atrioventricular valve. So, blood from the right atrium, the blood reaches from the right atrium from superior and inferior vena cava, that is from the lower side and upper side of the body, from the systemic circuit, and this right atrium, from the right atrium, the blood passes into the right ventricle through atrioventricular orifice, and this atrioventricular orifice is guarded by right atrioventricular valve. Now there is from the right ventricle, the blood goes to the right and left lungs via pulmonary artery, and this is the starting of pulmonary circuit. So, from the right ventricle, the blood goes into the lungs, right and left lungs through pulmonary artery. Now, this blood is deoxygenated blood. Now, the blood goes then from the lungs, it through the pulmonary veins, blood return to the left atrium, and the blood returns to the left atrium through pulmonary veins. That is the end of the pulmonary circuit. Now, from the left atrium, the blood again passes through the left ventricle. The left ventricle through guarded by left atrioventricular valve. It is also called mitral valve. So, then this left ventricle pumps the blood into the aorta. Aorta is the major artery or major vessel, and it pumps to the aorta and it supplies to the different parts of the body. That is, the oxygenated blood is supplied to the different parts of the body. Now, we already discussed that regarding there is a covering of the heart. It is called pericardium. Pericardium is a double walled sac around the heart. It composed of two parts, a superficial fibrous pericardium and a deep serous pericardium. A superficial fibrous and deep serous pericardium. Again, the deep serous pericardium can be again divided into two parts. A parietal pericardium, it is the outer lines, it lines the internal surface of the fibrous pericardium, and there is visceral pericardium, it is the innermost surface of the pericardium, or it lines the surface of the heart. And these two pericardiums are separated by a cavity called pericardial cavity, and it is filled by a fluid called pericardial fluid. Now, the function of this pericardium is, the first function is the protection of the heart, and the second function is it anchors the heart. Now, it also prevents the overfilling of the heart with the blood, and it allows the heart to work a relatively friction-free environment. Now we already discussed there is a pericardium, there is a superficial pericardium, also otherwise called fibrous pericardium, and there is a deep pericardium or serous pericardium. In the serous pericardium, again it's having a two part, a parietal pericardium and a visceral pericardium. In between these two parietal and visceral pericardium, there is a pericardial space which is filled by pericardial fluid, which protect and anchors the heart and prevent the overfilling and allows the heart to work relatively friction-free environment. Now, this pericardium, sometimes there may be any viral infection or bacterial infection may cause inflammation of the pericardium, and this complication of viral infection or bacterial infection is called pericarditis. Now, regarding the heart valves can be divided into three. It's having three layers: an epicardium, a myocardium, and an endocardium. Epicardium is the most superficial or more outer layer. Myocardium is the middle layer where mainly muscles are situated, and the endocardium is the innermost layer of the heart. Epicardium is the visceral, it is the visceral pericardium which covers the heart. Now, second layer is the myocardium. It is the muscular wall of the heart. Here there are, I told you, the muscles are called cardiac muscle. There is concentric layers of cardiac muscle tissues are there, and atrial myocardium wraps around great vessels also. There are two divisions of ventricular myocardium is there. There is a superficial ventricular muscles are there which surrounds the ventricle, and deep ventricular muscles are there which spiral around and between the ventricles. Now, the fibrous skeleton of the heart is crisscrossing interlacing layer of the connective tissue, and there is an inner layer called endocardium. This contains endothelial layer of cells. So, heart wall, it's having three parts: an epicardium, it's a part of visceral visceral pericardium itself. Then comes the myocardium where the muscular layer is there, and then endothelial layer, it is also called endocardium. Now, once we see the general anatomy of the heart, I already discussed there it's having an apex, it's having a base, and it is covered by a pericardial sac. Now, there is apex is pointed, the pointed tip is called apex, and where the greater veins and arteries is there, that area is called base. Base, where the greater arteries and veins are there, it is the upper side, and apex is, it is the pointed tip is called apex, and the entire heart is surrounded by a pericardial sac. Now, there are four chambers of the heart. There is a right atrium, there is a right ventricle, there is a left atrium and left ventricle. Right atrium, it collects the blood from systemic circuit. We already discussed it. There are arteries from there are veins from upper and lower side, that is superior vena cava and inferior vena cava, and it collects blood from upper side and lower side of the body, that is from the systemic circuit. Now, from the right atrium, next part is the right ventricle, and the function of this right ventricle is it pumps the blood into the pulmonary circuit. Left atrium receives the blood from the pulmonary circuit, and left ventricle pumps the blood to the systemic circuit. Now, blood vessels. There are three types of blood vessels are there. These are arteries, veins and capillaries. Arteries are the vessels which carries blood away from the heart. It's having thick walls, and thick muscles are also there, it is elastic. So, arteries are the vessels which carries blood away from the heart. Next one is the veins. It carries blood. So, arteries always contain oxygenated blood, and veins are the vessels which carries blood towards the heart or to heart. That is, mainly it contain deoxygenated blood. Now, the capillaries these are the exchanging vessels. They are the connection between the arteries and veins, and also it is also called exchanger vessels because this is the only, it is the exchange of material also occurs, like dissolved gas, nutrients, waste, and between the blood and tissue occurs at this level, capillary level. Now, once we see the overview of heart anatomy, there are four chambers: right atrium, right ventricle, left atrium, left ventricle. So, there are four chambers, then there are four valves also. Two valves at the entry at the entry to the ventricles, that is atrioventricular walls. That is, from entry to the ventricles there are two walls. Then two, two walls at the exit of the ventricle, that is to the great vessels, and there is no wall at the entry to the atria. So, entry and exit of the ventricle are supported by walls. Now, there are four major vessels are there. There is superior vena cava is there, and there is inferior vena cava. These are the entry vessels. Now, exit vessels are aorta and pulmonary trunk. Then there are four pulmonary vein, but it's not we cannot consider as a major vessel. This also an entry vessel. So, heart, once we see the overview of anatomy, it consists of four chambers, four walls, four vessels. Four walls, that is four chambers, two ventricles, two atria. Four walls, two at the entry of the ventricle, two at the exit of the ventricle. Four major vessels, that is that superior and inferior vena cava as entry, and aorta and pulmonary trunk as exit. Now, regarding the heart dividing lines, this is also called sulcus. These are, we can see, once we see heart from the outside, we can see there are some dividing lines between these atria and ventricles, and between the ventricles also. Now, these are called sulcus, and it contains blood vessels for the cardiac muscles. Sulcus are the grooves in the heart that divide the parts of the heart, and it contains blood vessels. There is a coronary sulcus which divide the atria and ventricle. There is a anterior and posterior interventricular sulcus which separates left and right ventricles. So, there are sulcus are there which separates the atria and ventricles, and between the ventricles also. The sulcuses are coronary sulcus, anterior and posterior interventricular sulcus. So, we already discussed right atrium receives deoxygenated blood through vena cava. Left atrium receives oxygenated blood through pulmonary veins. Right ventricle pumps the blood to the lungs through pulmonary arteries. Left ventricle pumps the blood into the systemic circuit through aorta. Now, the four chambers, the first chamber is the atria. These are atrias are small thin-walled chambers, and it's having an expandable outer auricles are there. These are the flaps on the anterior surface of the atria. Now, the filling of the atria is entirely passive filling, and these two atrias are separated by an interatrial septum, and it is connected, the atria is connected to the ventricle through atrioventricular walls, and it contains in inner covering there are some muscles called pectinate muscle. Pectinate muscle, it is almost like a comb, and it ridges the anterior wall and the inner surface of the right auricle. So, inner surface of the right auricle, there are pectinate muscles or comb type of muscles are present. Now, ventricles, there are two ventricles again. There is a right ventricle and a left ventricle, and right ventricle the wall is thinner, and right ventricle is almost pouch shaped. At the same time, left ventricle is rounded and it's having thick walls. Now, the trabeculae, there are muscles called trabeculae carneae inside the ventricle. There are certain muscle ridges inside the ventricle. These are called trabeculae carneae. Now, regarding the heart walls, we already discussed there are four walls, and all are in the same level of the heart. So, regarding the AV valve or atrioventricular valve, there are two atrioventricular valves are present. These are right atrioventricular valve and left atrioventricular valve. Right atrioventricular valve is also called tricuspid valve. It is seen between the right atria and right ventricle. So, it is having three parts, three cusps are there. Now, left atrioventricular valve, it is also called bicuspid valve. that is it's also called a mitral valve. It is seen between left atria and left ventricle. So, right atrioventricular valve is having 3 fibrous flaps and left atrioventricular valve is having 2 fibrous flaps. Now, another peculiar feature of all these valve is that it permits blood flow only in one direction. That is, it permits flow of the blood flow from atria to ventricle. It won't allow the blood to passes from ventricle to the atria. So, this is a peculiar feature of this valve. Now, the free edges of these flaps are attached by chorda tendineae to the papillary muscles of the ventricle. Now, blood pressure crosses the valve cuffs during the ventricular contraction. Now, the muscle tenses the chorda tendineae, preventing the valve from sinking into the atria. That is, so that because of this chorda tendineae muscle and because of this muscle, it prevents opening backward during ventricular systole. So, it is the work of the chorda tendineae muscle which prevent the opening backward, that is backward opening of the valves. Now, the second type of valve, the first type of valve is the valves between the atria and ventricle. There was 2 valves, and the second type of valves present in the heart is the semilunar valve. There are 2 types of semilunar valves are there. These are the pulmonary valve and aortic valve. Pulmonary valve is the valve present between the right ventricle and the pulmonary trunk, and the aortic valve is seen between the left ventricle and the aorta. Again, the main function of these valves are it prevent the backflow from the great vessels, that is to the ventricle. So, there are 2 semilunar valves are there, that is pulmonary valve and aortic valve. Pulmonary valve from the right ventricle and between the right ventricle and the pulmonary trunk, and aortic valve between the left ventricle and the aorta. The main function is it prevent the regurgitation or it prevent the backward flow of the blood. Now, these, like the atrioventricular valve, this does not have, unlike the atrioventricular valve, this does not have any muscular support. So, it is semilunar, it is having 3 crescent shaped cusp, and it is support like a tripod. Now, sometimes any failure of the valve, it causes a backflow of blood into the atria. This can cause heart murmurs. So, any failure of the valve can cause a backflow leading to heart murmurs. There are certain diseases called valvular heart diseases. These are genetic disorders or a complication of any inflammation of the heart muscle or carditis. And rheumatic fever is the common cause for valvular heart diseases. Now, in this condition, the valve function decreases to point where the adequate circulation is no longer possible. Now, there are some great vessels. These are called great vessels are there. There are great arteries and great veins are there. We will discuss about the veins now. The vena cavas are called vena cavas, and pulmonary veins are there. These are considered as great vessels. Vena cava, we already discussed, there are 2 vena cavas are there. There is superior vena cava and inferior vena cava. So, vena cava deliver systemic circulation to the right atrium. So, superior vena cava is there. It receives blood from the superior part, that is chest, upper limb, neck and head. From this part, it receives the blood and supply that blood, or the blood reaches through superior vena cava to the right atrium. And inferior vena cava, it receives blood from below the diaphragm, and it receives blood from trunk, viscera and the lower limb. And this is the one important vein. and the second one is there are right and left pulmonary veins return blood from the lungs. Now, great vessels. Mainly three types of great vessels are there. The first one is aorta, next is pulmonary trunk, and the third one is pulmonary arteries. Now, aorta receives blood from the left ventricle. There is after receiving the blood from the left ventricle, there is an ascending aorta. Then it forms a curve called aortic arch, and there is three branches and turn down and become descending aorta. Then pulmonary trunk split into left and right. Pulmonary arteries, it send blood from chambers through valve to lungs. And regarding the pulmonary circuit, to right atrium from superior and inferior vena cava, blood reaches to right atrium from superior and inferior vena cava. Then right atrium, it reaches through tricuspid valve and reaches the right ventricle. Then cornus arteriosus, that is superior right ventricle, that is through the pulmonary valve to the pulmonary trunk, and pulmonary trunk divided into left, right, and pulmonary arteries to right and left lungs respectively. And there is systemic circuit. This also we already discussed. Blood returns from the lung to the left atrium, then through the left and through two left and two right pulmonary veins, and left atrium, from left atrium to the left ventricle through mitral valve, and from left ventricle through into the ascending aorta, from ascending aorta then through aortic arch and become descending aorta. This is called systemic circuit. So, what is the complete pathway of lung? Complete pathway of blood through the heart and lung. From right atrium, tricuspid valve to the right ventricle, then pulmonary semilunar valve, then to the pulmonary artery, then reaches to the lungs, then to the pulmonary veins, left atrium, bicuspid valve, then left ventricle, aortic semilunar valve, aorta goes into systemic circulation. Then after covering the become the capillaries, then later comes the vena cava, and again it reaches to the right atrium. This is the complete pathway of blood through the heart and lung. Now, there is a structure called foramen ovale. That is, before birth, there is an opening between through an interarterial septum. It connects between two atria. But at the time of birth, it seals off, and later it is known as fossa ovalis. Now, aortic sinuses. Aortic sinus, these are the certain dilatation at the base of the ascending aorta. It prevents the aortic semilunar valve cups from sticking to the aorta when open. And origin point of the right, it is seen at the origin point. These are the origin points of the right and left coronary arteries. Internal heart driving lines are there. These are called septums. There is interatrial septum is there. Interatrial septum divides the atria and two atria, and interventricular septum separates the ventricle. Next is coronary circulation. So, coronary circulation is the circulation which gives blood supply to the heart itself. There are coronary arteries and veins are there. These are the part of coronary circulation. Coronary arteries and coronary veins are there. So, coronary arteries, there are two coronary arteries. There is left and right coronary arteries, and it originates at the aortic sinuses. And elastic rebound forces blood through the coronary arteries only between the contraction. And there is veins are also there. It returns blood to the coronary sinus and opens into the right atrium. These are this is called cardiac veins, which return blood to the coronary sinus and opens to the right atrium. So, we already discussed that there are right and left coronary artery, and right coronary artery supplies blood to right portion, right atrium, right portion of the both ventricle, cells of the SA node and AV nodes. And it's having branches, two branches mainly. There are marginal arteries and posterior interventricular artery. These are the branches of the right coronary artery. So, there are two coronary arteries are there. There is right coronary artery and left coronary artery. Right coronary artery supplies to the right atrium and a portion of the both ventricles, cells of the SA node and AV node. Now, left coronary artery supplies to the left ventricle, left atrium, interventricular septum. Again, it's having two branches, circumflex artery and anterior interventricular artery. Now, arterial anastomosis. This interconnects the anterior and posterior interventricular arteries. It stabilizes the blood supply to the cardiac muscle by providing a collateral circulation. Now, the conducting system of the systems of the heart. These are some specialized cardiac muscle cells that initiate and distribute the electrical impulses and stimulate the contraction of the heart. So, these are the cells which display automaticity, that is it contracts automatically without any external stimulation. These are SA nodes and AV nodes. These are the pace setters. So, there is a conducting system which contains SA node, then there is an internodal pathway, and there is AV node or atrioventricular node, and from the atrioventricular node there is atrioventricular bundle or bundle of His. Then there are bundle branches. From there are Purkinje fibers which supplies to the all over the ventricles. So, this is a conducting system, SA node, then AV node, SA node, internodal pathway, AV node, bundle of His, bundle branches and Purkinje fibers, together known as conducting system of the heart. SA node, it is seen at the posterior wall of the right atrium. It contains certain types of cell called pacemaker cell, and it is connected to the AV node by internodal pathway. Now, this is the SA node is the one which begins the atrial activation. Now, there is AV node is there. It is seen at the floor of the right atrium. It receives the impulse from SA node within 50 milliseconds. Then it takes impulses. It takes around 100 milliseconds for the impulses to travel through the AV node. Then atrial contraction begins within 150 milliseconds. Now, there is a pacemaker potential, an unstable resting potential of the conducting cells in SA node and AV node that gradually depolarizes towards the threshold. Now, SA node depolarizes faster than AV node, and SA fibers first establish these are the. So, SA node depolarizes faster than AV node. So, SA fires first, establishing the heart rate. Hence, we can call that is why we are calling SA node as the SA node as pacemaker. Now, there are conducting cells which conduct these impulses. That is, the first one is conducting cells. It interconnect the SA node and AV node. It distributes the stimulus through the myocardium. In the atrium, it is called internodal pathway. In the ventricle, it is called atrioventricular bundle and bundle branches. So, atrioventricular bundle is also called bundle of His. This is the only electrical connection between atria and ventricle, and it travels in the septum. It carries impulses from left to the right bundle branches which connect to the Purkinje fibers, and to the moderator band which connect to the papillary muscles. Now there are Purkinje fibers. It distributes impulse throughout the ventricle to the contractile cell, and it triggers the ventricular contraction to begin after arterial contraction is completed. So Purkinje fibers are the fibers which distribute impulses through the ventricles to the contractile cells, and it triggers it triggers the ventricular contraction once the atrial contraction is completed. So once we go through the activities, SA node activity, and there is SA node get active, and atrial activation begins. In the step 2, the stimulus spread across the atrial surface and reaches the AV node, and from there is around 100 millisecond delay at the AV node, and atrial contraction begins, and the impulses travel along the interventricular septum with the AV bundle, and the bundle branches to the Purkinje fibers and via moderator band to the papillary muscles of the right ventricle, and the impulse is distributed by the Purkinje fibers and relayed throughout the ventricular myocardium, and atrial contraction is completed and ventricular contraction begins. Now, so these are the pacemaker fibers, especially SA node are the pacemakers, and there may be some sometimes there may be chance of abnormalities of this pacemaker function. So these conditions, the first one is bradycardia. So it causes an abnormal slow heart rate. Tachycardia, it causes an abnormal fast heart rate, and there is ectopic pacemaker is also that is abnormal cell generated heart rate of action potential. Ectopic pacemakers, abnormal cell generated high rate of action potential, and it bypasses the conducting system and it disrupts the ventricular contraction. Now electrocardiogram, ECG. So the electrical events which occurring in a cardiac cycle can be recorded at the surface of the body using a method called electrocardiogram or ECG. Now abnormal pattern diagnosed as cardiac arrhythmias or abnormal electrical activity due to damage or disease. So these are the recording of the electrical events which occurs in a cardiac cycle. Now ECG, once we are taking an ECG, it's having different, that is ECG, it's having a wave called PQRST wave. Now each wave at P there is atrial depolarization is there. At QRS there is at the point of R there is ventricular depolarization, and T is the ventricular repolarization, etc. Then features of an ECG. P wave means SA node and atria depolarizes. Then QRS complex is where the ventricle depolarizes, and T wave is the point where ventricle repolarizes. Now if any abnormality, how can we find out the abnormalities in ECG? Consider if there is a large QRS wave, it is caused by a hypertrophy. If the QRS is small, it is due to reduced heart muscle mass. Small T wave, it is due to low energy reserve or ischemia. Long PR interval is there is damage to we can understand that there is damage to the conducting pathways. If long QT interval is there is conduction problem is there, or myocardial damage is there, or ischemia or congenital defect is there. So these are the different ECG problems. Now in this session we discussed about different anatomy of the heart, that is different chambers of the heart, and we discussed about the different circuits in the heart and regarding the pericardium and heart valves. Then how the conduction of the heart occurs, and we discussed about the different chambers of the heart. Thank you. Welcome back. This session we will be discussing about the cardiac cycle. Cardiac cycle can be defined as a period from the start of one heartbeat to the start of the next heartbeat. That is, it begins with action potential at SA node, and this transmit through the conducting system. So, cardiac cycle starts with action potential at SA node, and it conduct through the conducting system. Now, the conducting system, we already discussed regarding the conducting system. There is a SA node, there is AV node and conducting system. A conducting system is a system of specialized cardiac muscle cells that initiate and distribute electrical impulses that stimulate the contraction. And all these cells displays automaticity. These cells, conducting system, it contract automatically. There is no need of any stimulus, and these are SA and AV nodes are the pace setters. SA node we already discussed. These contain cells called pacemaker cells, and it is seen at the wall of the right atrium, and it is connected to the AV node by internodal pathways. And the SA node is the point where the atrial activation starts. And there is AV node also, we already discussed this one. It receives impulse from SA node and it is seen at the right atrium, and it takes some time to, it takes around 100 milliseconds for the impulses to travel through the AV node. It delays the impulses and there is then atrial contraction begins. And there are conducting cells are there, that is between, this is called internodal pathways, interconnect between SA node and AV node, and it distributes the stimulus through the myocardium, and in the ventricle there is AV bundle and bundle branches are also there. AV bundle is also called bundle of His, and this is the only electrical connection between atria and ventricle, and it carries there is right and left bundle branches are there. From the bundle branches there is Purkinje fiber starts, and the Purkinje fibers through the moderator band it passes through the papillary muscles for the contraction, and Purkinje fibers distribute the impulse throughout the ventricle, and it triggers the ventricular contraction after the atrial contraction completes. Now, heart excitation related to ECG, first of all there is SA node generate the impulses and atrial excitation begins, and the impulses delayed at the AV node, and impulses passes through the heart apex, ventricular excitation begins, and after that it reaches through the Purkinje fibers and the ventricular excitation completes. And regarding the ECG, we already discussed once the cardiac cycle, the electrical events which occurs in the cardiac cycle is recorded, it is known as, if it is recorded, it is known as electrocardiogram or ECG. If there is any abnormality like arrhythmia or due to any damage of the muscle or any diseases, it can also be recorded in the ECG. So, ECG we already discussed, there is P wave, there is QRS complex, there is T wave is there, P wave, it is P wave, it is SA node and atria depolarizes, and QRS complex is where when the ventricle depolarizes, and T wave is where the ventricle repolarizes. Now, there is PR intervals are there, time intervals are there. PR intervals from the starting of the atrial depolarization to the start of the QRS complex. QT interval is from ventricular depolarization to ventricular repolarization. So, QT interval is from ventricular depolarization to ventricular repolarization. Now, how we can find out if any abnormality is there in the ECG? If there is a large QRS complex, it is caused by a hypertrophy. If the QRS complex is small, if the QRS is small, it is due to the reduced heart muscle mass. If there is small T wave, it is due to low energy reserve or ischemia. If there is long PR interval, it is due to the damage to the conducting pathways. If there is long QT intervals, there is conducting problem, there is myocardial damage, there is chance of there is maybe due to ischemia or any congenital defects. Now, cardiac cycle. Cardiac cycle can be defined as the period between start of one heartbeat to the beginning of the next. It includes both contraction and relaxation. That is, systole, there is systole and diastole is there. Systole is the contraction. At this stage, pressure rises, and diastole is the relaxation. At this stage, pressure falls. And always, like any other fluid, blood also flow from high to low pressure and controlled by timing of contraction and directed by the one-way valve. So, blood flow from high pressure to the low pressure area, but it is controlled by the timing of contraction and directed by the one-way valves. Now, phases of cardiac cycle. Cardiac cycle can be divided into 4 phases. There is an atrial systole, there is an atrial diastole, there is a ventricular systole, and there is a ventricular diastole. So, it is starting with atrial systole, begins with atrial contraction, forces a small amount of additional blood into the relaxed ventricle. Now, atrial systole ends and atrial diastole begins. Then after, in the next stage, ventricular systole first phase starts, that is ventricular contraction pushes the atrioventricular valve closed, but does not create enough pressure to open the semilunar valve. In the next stage, ventricular systole second phase, where the ventricular pressure rises and exceeds pressure of the arteries, the semilunar valve open and blood is ejected. Now, ventricular diastole early stage, as the ventricle relaxes, pressure in the ventricle drops and blood flow back against the cups of the semilunar valve and forces them closed and blood flow into the relaxed atria. In the last stage is the ventricular diastole later stage, where all chambers are relaxed and ventricle fill passively. Now, cardiac cycle and heart rate. As at 75 beats per minute, each cardiac cycle lasts for at least about 800 milliseconds. When the heart rate increases, all phases of cardiac cycle shortens, but particularly ventricular systole. So, heart rate starts, ventricular diastole, that is, when heart rate increases, all phases of cardiac cycle short, especially ventricular diastole, there should be less time spent in resting. There are 8 steps. We can classify the cardiac cycle, we can divide the cardiac cycle into 8 steps. The first one is the atrial systole begins. That is, first one is there is atrial contraction begins. That is, there is a rise in the pressure force, open right and left atrioventricular valves. There is no venous flow into the atria, but little backflow either. Then, second stage is the atria eject blood into the ventricle. That is, it causing the filling of the ventricle. Third stage is the atrial systole ends. That is, ventricle contain maximum volume, that is end diastolic volume, which is normally about 130 ml. That is, third point is the ending of the atrial systole and ventricle contain the maximum volume of the blood. Now, ventricular systole begins, that is AV valve close, as the pressure in the ventricle quickly exceeds the pressure in the atria. The pressure in the ventricle continues to rise, all the valves get closed. At this point, all the valves will get closed and there is isovolumetric ventricular contraction is there. The fifth stage is the ventricular ejection. That is, when the pressure in the ventricle exceeds the arterial pressure of the great vessel, the semilunar valves are forced to open. The blood flow into the pulmonary and aortic trunks, there is isotonic contraction is there. Then in the sixth step, the ventricular pressure falls near end of systole. That is, there is backflow from the vessel's trunk closes the semilunar valve, and ventricles remain in the end systolic volume, that is ESV, about 4% of the end diastolic volume. And the next stage is the ventricular diastole, and ventricular pressure is still higher than the arterial pressure. All the heart valves are closed and ventricle relax. Then this is called isovolumetric relaxation. Now the last step is the falling of the ventricular pressure drops below the arterial pressure. It forces again the AV valves to open, and passive atrial filling is there, and passive ventricular filling is there, and cardiac cycle ends. So again the same repetition of the 8 steps will be there again. Consider when there is lack of adequate blood supply to the peripheral tissue and organs due to, if there is any inadequate cardiac output, usually due to any ventricular damage. This condition is called heart failure. That is, lack of adequate blood flow to the peripheral tissues and organs due to inadequate cardiovascular output, especially seen in ventricular damage. This condition is called heart failure. That is, atrial damage can be inconsequential consequential or problematic depending upon what is damaged. Now regarding the heart sounds, there are 2 types of sound, left depth sounds. That is, sounds are called S1 and S2. That is, S1 left sound is the loud sound produced by AV valve closing, signifies the beginning of the systole. And the second sound is the depth sound. It is a loud sound produced by semilunar valve closing, That is, there are once in auscultation we can hear 2 types of heart sound. These are leb and dub. That is, we can call it as S1 and S2. S1 is it is due to the closing of the AV valve, and S2 is due to the closing of semilunar valve. S1 signifies the beginning of the systole, and S2 signifies the beginning of ventricular diastole. Now, energy to the heart, aerobic energy to the heart. It is from mitochondrial breakdown of the fatty acids and glucose, and oxygen is from circulating hemoglobin, and cardiac muscles store oxygen in the myoglobin. Now we will go through some important cardiodynamic terms. The first term is the end diastolic volume, or EDV. It is the maximum filling after atrial systole. It is called end diastolic volume. Usually it is about 130 ml. Next is end systolic volume. It is the residual volume of blood after a ventricular systole. It comes around 50 ml. Stroke volume is the volume of the blood ejected per beat. That is, end diastolic volume minus end systolic volume is known as stroke volume. So there is end diastolic volume is there, end systolic volume is there. The difference between end diastolic volume and end systolic volume is known as the stroke volume. Then there is ejection fraction. It is the percentage of end diastolic volume represented by stroke volume. Then cardiac output, the volume pumped by each ventricle in 1 minute is called cardiac output. It equals to how much blood get into the tissues in every minute. So cardiac output means heart rate into stroke volume. Now, the factors affecting stroke volume. That is, the first one is changes in end diastolic volume or end systolic volume. Slow heartbeat and exercise can increase the venous return to the heart, increasing the stroke volume. Then blood loss and extremely rapid heart rate can decrease the stroke volume. An end diastolic volume is affected by the filling time, that is duration of the ventricular systole and rate of venous return, the rate of blood flow during the ventricular diastole. An end systolic volume is affected by preload, contractibility and afterload. Preload, the degree of ventricular stretching during the systole, diastole due to amount of blood increased by greater venous return. Contractility means the force produced during contraction at a given preload, and afterload means tension of the ventricle must produce to open the semilunar valve and eject the blood through great vessels. At rest, end diastolic volume is low, myocardium stretches little and stroke volume is low, and end systolic volume is high. With exercise, end diastolic volume increases and there is an increased venous return, myocardium stretches more and stroke volume increases, end systolic volume decreases. Now, end systolic volume and stroke volume, that is contractility, is affected by sympathetic activation, parasympathetic activity, hormones and drugs which mimic the hormones. Contractility is affected by, the first one is sympathetic activation. Next one is parasympathetic, like acetylcholine release by vagus nerve reduces the force of cardiac contraction. Now, hormones which also affect the contractility of the heart and drug which stimulate the hormone action, that is stimulate or beta blockers, block beta 1 receptors or beta blockers. And next one is effect of calcium ion, calcium channel blockers decrease the contractibility. Now, the factors which control the heart rate. There are mainly 3 factors which control the heart rate. That is, first one is autonomic nervous system. It may be either sympathetic or parasympathetic system. Second one is circulating hormones. And the third one is venous return and stretch receptors. Autonomic nervous system, that is, heart is stimulated by sympathetic activity and heart is inhibited by the parasympathetic cardio inhibitory centers. Now, vagus nerve carry parasympathetic preganglionic fibers to the small ganglia in the cardiac plexus.